anyone who's had a urinary tract infection knows how unbearable the pain can be. But while most clear up within a few days, for some women, including our next guest, the agony can persist for years.
Lisa Gray endured 3 decades of excruciating pain and debilitating symptoms from recurring infections before reaching out to UTI specialist Dr. Kat Anderson, who was finally able to help. And it's great to have them both with us here this morning. Morning to both of you. So Lisa, let's go back to when you first started getting the symptoms. Just how debilitating were they and how long would it go on for?
So for me, it all started in my 20s. I just had a whole run of really bad infections where I ended up weeing blood, and the agony was sort of indescribable because you think it's just about a twinge, but actually it was like sitting on a hot poker with weeing razor blades. So they carried on for a few years and then settled down into a pattern of maybe about 1 or 2 a year, and that carried on for the next 20 years.
20 years. And was there specific things that would trigger those infections coming on?
I think it's different for every woman. I think often it can be around stress, dehydration, sex can not often be a factor. So they were the things for me. I think over the last 20 years, it always happened at the most inconvenient times. I was always away or it was out of hours. So, you know, one awful time was I was on a camping holiday and I felt a bit of a twinge. I ended up going to the nearest A&E. But for me, they were always so acute in how they came on. So within an hour, if I hadn't taken an antibiotic, I knew that I would be sort of unable to function with a fever within an hour. And so that time I ended up in A&E. By the time they gave me the antibiotics, I was on an intravenous IV drip with antibiotics and a relaxant because I was in such a state. So it was always just trying to get access to the treatment as quickly as I could. That was always tricky.
And it always happens so quickly as well. You don't have much time to kind of react to it.
No, absolutely. I went for a walk once. I was about an hour away from home, and by the time I got a twinge an hour in, I only just about managed to get back to the house, and I had by then some emergency antibiotics, and I started travelling with those.
Yes.
Because I ended up in Sri Lanka on my honeymoon in a tea plantation, which was beautiful. But at altitude, my antibiotics just weren't kicking in, and I ended up with a real fever, hallucinations. Just wasn't sure that the treatment was kicking in, which was so scary when you're in a place where you don't know the healthcare system.
You must have felt so lost as well because you've been dealing with it for so long, knowing that it was always going to be a problem and not actually being able to sort it out.
Absolutely. I was just getting so desperate.
Yeah.
And then I reached my 40s and it got even worse. And I was getting infections maybe once every month. In desperation, Googling sleepless nights in agony, trying to work out what was happening to me and how to stop them. And that's when I found a bladder charity called Bladder Health UK. They sent me a list of specialists. I found a couple of online support groups. So I knew I wasn't alone in this struggle. And then I saw Dr. Anderson, the amazing Dr. Anderson, and she put me on a longer course of antibiotics, a bladder antiseptic drug called Hiprex, methanamine hippurate, which was a real game changer for me. And also told me about the really important role of hormones. So as I was hitting my perimenopause, which I went into completely blind, that's when it started to really go bad because oestrogen is so important for bladder health, and I just hadn't realised. So added some local and systemic HRT into that treatment plan. And then gradually over the last, say, 5 or 6 years, I haven't had an infection now for 4 years, which is the longest I think I've ever gone. So I feel like I'm on a road to recovery, but not totally cured, because you always still live with that awful lingering fear and anxiety that one is going to come and grab you when you least want it.
Yeah, but thank goodness you found Dr. Anderson.
Absolutely.
Because I think that one of the things that women really need is to feel heard and for people to understand just how debilitating this is.
Absolutely, absolutely. I think that Lisa has had a terrible time in the past with her UTIs, but it's quite surprising when you hear that I actually see people who come in an even worse situation than she is in. I've had patients that are so desperate with this, breast cancer survivors who say that if they had had this before the breast cancer, they would have declined treatment because there would have been a way out. I've had a patient who developed this after developing breast cancer, and we'd pulled her out of the worst of it, and she checked with her breast surgeon whether going through the treatment would actually make her symptoms come back again, her UTI, her persistently recurrent chronic UTI symptoms come back. And she said because she wanted to decline treatment for the breast cancer if it did, because at least there'd be a way out.
Goodness me.
That's pretty compelling, isn't it?
For sure.
Yeah. So it's really important that, you know, we give this disease the importance that, you know, it
But Dr. Cat, how have we got to this point where there are women like Lisa dealing with... My wife has the same antibiotic that you do now, and it's been a game changer for her, because as soon as she senses there's a twinge, or she'll take one of the tablets and it goes away. And I've been with her when it's been really debilitating. We're in a lovely spot or whatever, and suddenly she can't leave the room, or she can't get out of bed. How has that happened? How have we got there?
So, unfortunately, we're in a situation whereby up to 50% of the tests to detect the bacteria come up negative, even when there is genuine infection there. And that's in the flash in the pan, once-in-a-while UTIs, not the recurrent UTIs. We know the figures are much worse for the people with recurrent UTI, and it's on a continuum. It's even worse than that with chronic UTI. And chronic UTI isn't actually yet a medical definition, but we know it exists, and it actually even is, we're able to diagnose it. It's on the computer in our surgeries. So we really aren't giving it the importance that it needs in terms of testing. The dipstick tests that GPs and nurses use in primary care and in hospitals, they will show negative up to half the time as well, even when there is genuine infection there. And this is backed by our recent revision on guidelines just a year or so ago, where we should all be, as doctors and nurses, when a patient comes in and they have two key features of UTI, we should be saying, right, OK, this is enough to start treatment for them, and not be relying on dipsticks and not be relying on these tests. And when we look further into the tests, as we were discussing earlier, Kat, the tests rely on a threshold that was set on a study that was done 70 years ago on 88 pregnant women with kidney infections, not bladder infections.
Just doesn't make any sense
So in
at
this
all.
day and age of fantastic medical evidence, that's not good enough.
But there is good news, though. There's looking as though the drug that Lisa takes is going to be more widely available.
So I can't actually talk about this yet because of conflict of interest, because of some work that I'm doing on committees nationally. But watch this space. Watch this space.
But from your perspective, Lisa, like you said, your personal anecdotal experience is that has been a game changer for you, and it should be available for more women who desperately need it.
Absolutely, because you go to the doctors, but often antibiotics will be the first course of treatment, but it's only a very short course and it's just not enough. And one of the things that I learned was my infection had probably actually always been the same infection that hadn't been cleared in my 20s, that then persisted and then keeps recurring. So it's just trying to knock that back. And although I was on the longer course of antibiotics, it was the Hiprex longer term, which has just over time made me feel like things were improving to the extent I wasn't always in fear of getting another one.
So, Dr. Cat, what does Hiprex do then? Can you explain how
I know it's complicated.
I know it is, but can you explain how it works from a medical?
It's a urinary antiseptic, basically.
Okay.
It's not an antibiotic, so there isn't problems with antibiotic resistance issues, etc. But for these ladies that keep getting the infections, or the infections just never go away, there's some very good evidence that came out of the USA over the last few years that shows that rather than being new infections all the time, there's a distinct possibility that a great proportion of these cases, it's an embedded infection actually within the bladder lining. So the bugs have hunkered down inside the cells and they are just waiting till the coast is clear to come back out and set up a new round of attack on the bladder lining. And so what we need to do is we need to put something in to stop them doing that. Or if they do leak out and they want to get going again, put in something that's going to kill them straight away. And so a low-dose antibiotic all the time can do that. or maybe something like an antiseptic can do that.
Which
So this
clearly
is where
works.
they're the game changers.
Amazing.
Look,
I think it works over time as well, just to...
and that's the thing. So you're 4 years since you had your
brilliant.
last one. You haven't quite relinquished that fear of another one coming on, but clearly things are significantly better than they were, Lisa.
Absolutely, and I do feel like I'm one of the lucky ones because I was able to access, treatment that worked for me, the testing that showed a clear bacteria. Not all women are in that position, so we do need better testing, better treatments.
OK, Dr Cat, will you do us a favour? In a couple of weeks' time, will you come back again?
When you
you
can.
can talk a little bit more, and also, will you come and do a phone-in for us, for our viewers?
I would
as
love
well?
to. I would absolutely love
I
to
just
do
love
that.
the no-nonsense approach, and let's get it
I think,
sorted.
and also personal experience with Annie and anecdotally Lisa as well. There will be lots of our viewers this morning that would absolutely massively value your expertise as well.
Oh,
if you could do
no
that.
problem. That would be great.
Amazing.
We need better diagnostics and better treatment plans for these patients. And I promise you, in the background, working really hard on all of that, myself and a few esteemed colleagues, and we're running with this in the same way that we've been running with menopause. I know how much you guys have done for that. We're now running with these UTI issues.
Brilliant.
Excellent.
Thank you both for coming in, Lisa. Thank you for being so honest and continued positivity regarding not having another UTI. Dr. Cat, we'll see you in a couple of weeks.
Oh, hello. See you soon.
Thank you for visiting our This Morning YouTube channel. We upload tons of new content every single day. So hit the subscribe button, like all the videos, and don't miss out. We'll see you in the morning.